So for today's video, we're going to be talking about passive range of motion for the cervical spine. Now, passive range of motion is best done when your patient can be in a relaxed position. You really should focus on standardizing it such that if they're in a supine position, great, always have them in that position, or if they're in a hook-lying position with the knees bent up, that's fine as well. You can also have them standardized there. For passive range of motion, I like to have my patient's head or the crown of their head right kind of at my belt buckle or at my waistline, such that I'm not having to lift their head up or really stoop over. I can still be aware and maintaining my own body mechanics. Additionally, you'll notice that as of right now, the pillow is kind of supporting our patient's shoulders. We want to slide that pillow out and down such that the shoulders can be relaxed, the individual can be relaxed, and we can just focus on the cervical spine. Now, when we're going through passive range of motion, if we just go to begin to rotate our patient's head and neck, one of the things you'll notice is they no longer are in a midline posture. Part of the reason for that is the orientation of the facet joint or the zygoapophyseal joint. Recognize that in the cervical spine, lateral flexion and rotation are coupled. Therefore, if you rotate, you're also going to laterally flex. So when we go to begin moving the head and neck passively, we want to scoop our hand into the pillow in kind of this curvilinear fashion such that we can really facilitate rotation that allows the individual to stay in midline. So it's my left hand that's scooping into the pillow. We don't see any increased kind of tonicity of the sternocleidomastoid here, so we recognize then that the individual is not trying to lift their head off the table. See how much of that kind of muscle will pop out of the lateral neck if they're not relaxed. So again, we scoop into the pillow, the individual is relaxed. Now at this point we can do our assessment of overpressure. I like to use my thumb kind of right in line with the zygomatic arch. And we want to watch the patient's eyes at end range rotation because the cervical artery, as it passes through those transverse processes, can become impinged. We'll look and see if there is any nystagmus or if the patient begins to demonstrate any apprehension at that point. We can also move to the other side. Again, keeping the ear in midline. Same, thumb in line with the zygomatic arch. Watch the eyes. End range overpressure. And come back to neutral. Now we can also assess lateral flexion. For this, it's okay if the pillow moves with us. We're going to go to the side. If by chance the individual would have a significant amount of tightness through the upper trap here on the left-hand side, we can ask the individual to shrug the shoulder. That alleviates some of that muscle length issue, and typically we're able to get significantly more lateral flexion. That would be one way to differentiate between more of a joint issue versus a tissue length issue. Lateral flexion can be done to the opposite side as well. So now we're ready for flexion and extension. For flexion, I like to stand kind of at an oblique angle, 45 degrees. We're going to bring the individual up, chin to chest, support, and then we can look at that overpressure as well. Allow the individual to come back. You're looking for any signs that the individual may be guarding or beginning to engage the muscles in and around the cervical spine. And then finally we come to extension. Now extension is the most challenging. To enable the patient to stay relaxed, we want their head in a relaxed position. We're going to remove the pillow, place on the stomach. The benefit of these tables is the headrest will drop. I have the patient's head. I'm going to come into a staggered stance position, and we're going to bring the head and neck back into extension. When we're ready to return to a neutral position, I can help my patient to stay calm and relaxed. I can bring the head of the table back up, bring the pillow back around, and allow them to relax. So, have a go with cervical passive range of motion. Get a feel for your position of the table, releasing that head unit such that you can get into a fully extended position. Have a go with a peer or colleague and let me know if there's any questions.